Hello and welcome back. I'm going to really try and stay on task because I know in my other videos I trail off. But again, these are my first videos. I'm trying to have a creative dialogue, but at the same time, make sure it's informational and on track in some sort of fashion. And so this one, I'm going to talk about. I'm going to talk about how historically with like hypnobirthing, traditional birthing, and people who have really played a role in the birthing realm and industry, why and how. So I'm going to start off with the two gentlemen that I mentioned one gentleman, John Morgan. The other gentleman is William Shippen. And this is back in the 1700s, right? From my other video. So John Morgan is the one who established that medical college. William Shippen was supposed to be a partner in that medical college. He was the first professor at the college, and he was applying midwifery as well as his science and medical approach in his lectures and his studies and his research. That was kind of the turn of like the it's a double-edged sword because it was good for the progress and safety of the medicalized birthing industry, but it was also dangerous because of the path that it was going to take birth on. Now, these two individuals, they were highly, highly ranked in society. They were already political. William Shippen's great-grandfather was the mayor of Philadelphia. So this was in Philadelphia, right? Uh, John Morgan and William Shippen, they went to Princeton in Great Britain, right? And England was when they were already using dangerous, yes, I'm saying dangerous because they were and are dangerous to use. Intervention tools like forceps. They did not help. They caused more damage, just like episiotomies. Episiotomies cause larger tears than, you know, they cut tissue, just to be really quick, they cut tissue that wouldn't essentially tear in the first place. You know what I mean? It's just they are causing more damage than helping. Our Just like a penis can flex and then relax, our vagina works in the same way, right? Vaginas work in the same way where they have elasticity. There's blood flow, there's elasticity. So it's not needed. Anyways, they went to college at Princeton, came back to Philadelphia, and they already had their entrepreneurial mind, right? They showcased the business proposition for the medical school, and they automatically started going at the different revenue areas and business aspects. And William Shippen was the first one to establish a maternity ward or obstetrics medicalized establishment, like with hospitals, right? And it blows my mind because these people who already had high pull and political gain are the ones who are influencing this atmosphere. Again, it's a double-edged sword. But then I'm going to fast forward super far, all the way to the 1900s, where Ina May, right? Ina May, she wrote this book. I know it's backwards, I'm sorry, but it's Ina May's Guide to Childbirth. She was born in the 40s, and she was I did bring her up, but she was the godmother, right? She was like seen as the ultimate midwife. Her and some of her gals were traveling the road in the 70s, and they were just birthing each other's babies, as it was originally done, centuries ago and hundreds of years ago. Well, I shouldn't say hundreds of years because they, were not being supported hundreds of years ago like that. It was seen, anyways. They were the ones, Ina May and her pals were the ones who opened up the farm. The farm is where they were wondering why everything was so medicalized, right? Because hospital births were like, it was exploded, right, by the 1900s. And so they were wondering, well, why do we have to go to a hospital, and why do we have to like be put under anesthesia? Why do we have to get drugs? Why do we have to like do all this crazy stuff when, I mean, like we've just been like giving birth, you know what I mean? She has witnessed, her book blew my mind because I didn't even know that this was a thing. She has actually witnessed women, right, in labor, a thought or something that someone says or a person has inflicted a negative influence on the birthing mom, and she would be crowning, or she would be, uh, the baby would be going down the canal, and she would witness her body retract. So the mother's body would regress. Isn't that, it's so crazy, so crazy, blows my mind. But Ina May really, really, she blossomed and helped recreate the beautiful view on midwifery and home birthing and women supporting women in birthing, and midwifery really started to go on a rise again. All this being said, with like the political gain and then, the natural approach, right? That's like really supported. And, I mean, the postpartum depression and PTSD, the risks and side effects associated with natural birthing, and women supported birthing is slim to none with that approach. Medicalized birth, there are constant lists of side effects and essentially consequences of other people's actions and decisions on our bodies, right? So, hypnobirthing, just to kind of tie these together, Jeepers cats, all the fuzziness, always. Like, I'm just like, why can't I focus? But Ina May's got childbirth and hypnobirthing. They definitely go hand in hand. And so, that approach is so beautiful. I've gotten to experience all of the realms, right? The hospital, birth center, and then home birth. And I'm telling you, like, this changed me. So now, present day, I'm going to show you a little chart, for cesarean sections. This is one main, but it's the most common intervention, right? Well, it's actually depends on how you put it, but uh, surgical intervention is, cesarean section, right? They say one argument is, I hear someone talking, is CPD, right? It's the condition where a woman's pelvis is seen as, too small, or uh, the baby's too big. Uh, yeah, that doesn't. Oh, okay. Okay. Sorry. I always like to like double check myself before I like say something, because I'm gonna go to say, like, just like in the other video, it's like cytotechin, NMI, meh, meh. But cephalopelvic disproportion, and it's like the idea that your pelvis is too small again, or the baby's too big. But the thing is, you have a 0.4% chance, literally a 0.4% chance of that even being relevant to you. It happens extremely, extremely rare, usually in, this is gonna sound weird, but in pure genetics from certain ethnicities. And you can go more into that, but it does not happen as common as they argue it for cesarean section. So more than 1 in 3 women get a cesarean section. I'm one of 5 girls, right? 4 of us have had babies, and I'm the only one who has had natural births. All my other sisters have had cesarean sections, and they were told, you have a septum uterus. Well, you wouldn't see that when you're in labor. You see that way early in your prenatal visits when they're doing an ultrasound, right? That wouldn't be a last minute emergency with that they just throw on you, that they're looking at you from the outside. And I'm not saying any of this to take away from anyone's birth experiences. I just get upset when they use bullshit reasons and the women have to figure out how to handle the side effects of what they're throwing at them. You are terrifying these women, thinking that it's life or death. Oh my God, you're going to put my guts on the table. And it's like, can we be a little bit more professional? Can you stop having an ego and throwing these big terms at people that they don't understand because you like to feel holier than thou, higher than, put yourself up on a pedestal? This is someone's life. This is someone's family, Where did the compassion go? Where did the honor go? Where did the love? Where did the heartfelt approach go for this industry? You know what I mean? It's not a business, and it has become a business incentive. Just look up testimonies. That's all I'll say. Uh, my other sister was forced to push for 2.5 hours, and then, it induced fetal distress. And I mean, again, I'm going to do another episode on the medications that they give you and all the side effects and consequences that come from that they don't tell you. So, and cesarean sections, right? Jeepers cats. So more than 1 in 3 women, right, that walk in that door get a C-section in a hospital, birth center, or at home. I'll just say birth center, right? The birth center that I've given birth at and other establishments, less than 1 in 10 women with planned cesarean sections, right? With planned cesarean sections are transferred to the hospital. They still use the midwife practices and the midwife support, but they already know that they're maybe like high risk or are trying to do for a VBAC, and so they just kind of set themselves up for success. And that is the whole point, right? To literally plan for the birth that you envision, that your heart wants, that your family deserves, and then the people respect that and they truly customize it to you. And if it actually comes to it, if it actually is a factual circumstance that it's brothers brothers playing with sister. They're playing in the dirt. Um so uh it's just the I'm going to go over in depth in a very short video, cesarean sections and the side effects that come with that and why. This is already going on 14 minutes and I feel bad for how long my videos are, but it's really hard to talk about this subject and not have it go past 10 minutes. But they say that the CPD is, when you look at the numbers and the statistics, it's 0.4 chance that you have that, right? And yet 1 in 3 C-sections, they use that as the reason for you to get a cesarean section. That's factually impossible. So again, when a woman is in labor, you cannot see through the skin. You can't see through the tissue. You're not doing an x-ray or an ultrasound while she's in labor for them to use that as a last minute reason. Are you following me? I really hope you're following me, because it's like saying that you have x-ray vision and that you're like, oh, well, the baby's too big. or like your pelvis like just can't birth a baby. And it's like, well, actually the baby's probably just in a position where mom needs to shift, right? Which is totally natural. I've had to do it. I've met many women who have adjusted and moved, and that's oftentimes why your body feels the need to move. And midwives can actually, they're very good at recognizing, because then they can do an exam, and when they do like the exam externally, they can feel what position specifically that the baby is in, and then they can have an educated understanding of how that might affect. And this is also why positioning, right, why you are kind of recommended to get chiropractic work done, because your falls, accidents, injuries and workouts, not stretching can put your body out of alignment. And it really does help. It really, really, really does help. So if you didn't know about that and you're pregnant, there are plenty of people that are absolutely amazing with doing chiropractic work while you're pregnant. So I recommend it, and it also feels amazing. This is the thing, right? So you have these people who are like realizing the beautiful natural ability of birth, but then you have the other realm that's like still seeing the business, the business opportunity. And so they're like, oh, well, I make more money if I just cut her open and take the baby out. But then I also don't tell her that her body's going to be in shock, might start to think that she lost the baby. I'm not going to trail off, but then your body will be in shock, and it'll like initially start to think that you lost the baby. But then if you breastfeed, then you'll have like a quicker recovery, because then the hormones and your like your psychological and anatomical body will like resync, and it'll be like, oh, okay, well, that was really weird. I don't know why it didn't naturally happen. But okay, let's figure out how to get back in the rhythm, and it'll start healing how it's supposed to. But when you formula feed, your body doesn't get that signaling. So your body starts to think that you lost the baby. And I'm sure no one's ever told you that. So this is a very important information for them to disclose, and they don't. They're just like, oh yeah, you're fine. You literally had major surgery, but 6 weeks recovery. Let us know if you start to get woozy, or fever, because then you'll get and probably an infection. You gotta get antibiotics. No big deal. And it's like, can we be a little bit more sensitive? Can we be a little bit more compassionate? And can we actually try harder instead of making it about your pocket? Um, so I'm gonna, those are the points I'm trying to make, right? Historically, when midwifery and childbirth met science and medical school and hospitals, that's when it was good for sanitary reasons, because lower class like didn't have like, they didn't have the cleanest of houses. Um, but then it also destroyed the respect for childbirth. It was literally an honor. It was like you were ecstatic if you were invited to a birth, and now it's not the case. So I'm hoping we can turn that around. And there is a slow incline to home births and birth center births, so that's exciting. So maybe this will help it along. Okay, so next one, I will actually go through some more points with hypnobirthing. And then there's like so many videos that I want to make, and so many in my head. And I feel like I can't make them fast enough. It's hard when you have a little one, and I try to take advantage when she's napping. But that's like one a day, and she like does not sleep like throughout the night. So that's difficult. And I'm trying to sleep, so I'm not gonna, anyways. Okay. Well, I'm going to close out with prayer, because I think it's important that we give this to God and bless it, because that's what it's about, right? If it's not for God, then I don't want it. But Lord, I really pray that anyone who watches these videos, who knows of someone who is pregnant or just takes even 1% of this information, I pray that it changes the course of their birth and so that they feel honored and respected and loved through their experience. I pray that it establishes an unwavering foundation in their family. So thank you so much for this time. Thank you so much for the people watching. And I pray that everyone has a peaceful and safe and beautiful rest of their day. Amen. Okay. All right. See you in the next one. Bye.